Okay, Mr. Yankee, you can have a seat on the examiner room table, and the nurse is going to be right in with you. Okay?
Thank you.
You're welcome.
Come in.
Hi, are you Mr. Yankee?
I am.
Hi, I'm Julie. I'm going to be your nurse this afternoon.
Nice to meet you.
It's nice to meet you as well. I am coming to perform a head-to-toe assessment on you.
Okay.
Is this a good time?
It is.
Okay, wonderful. I'm just going to wash my hands first.
Sure.
Okay. All right. And then, do you have a hospital
I do.
bracelet on? Okay. And can you just verify your name and date of birth?
Yes, Matthew Yankee. My birthday's 2/29/80.
Okay, perfect. And then, do you have any allergies to any medications or to latex?
No, neither.
Okay. And are you having any pain today?
Oh, I'm good.
Okay, perfect. So like I kind of had said that I'm going to do a head-to-toe assessment. I'm basically going to go through all your body systems, starting from your head all the way down to your toes.
Sounds thorough.
Very thorough. Just let me know if you are having any tenderness or any pain while I am performing the whole procedure here.
Sounds good.
And how old are you?
I'm 42.
42, okay. And what's your height?
It's about 6'1",
Okay, and what about weight?
225.
Okay, so just from my general survey observations, I would say that patient is a 42-year-old Caucasian male. He is well nourished, well groomed, appears in no acute distress. Height is 6'1" with a weight of 225, so that would have put him at a BMI of 30. As far as body structure, I do know that he is of normal stature. Everything is equally aligned. And as far as his posture, it looks like he's relaxed yet erect. He doesn't elicit any pain or distress, no tripoding. And then as far as his behavior, I do notice that his hygiene, grooming, his dress is within normal limits. He's well maintained. There's no odors. Mood and affect seem appropriate. And speech is regular rate and rhythm. He doesn't appear to have any pressured speech. And as far as facial expressions, they are appropriate and appropriate for this visit and the situation. So, and then as far as his mobility, the nursing aide did notice that he had equal and smooth movements. He ambulated with an intelligent gait. He didn't need any assistive devices to walk. And I'm able to discern from a series of questions about his orientation. And I'm going to ask you 4 different questions.
Okay.
What is your name?
My name is Matthew Yankee.
And where are you at?
I am at Northwestern Doctor's Office.
Okay, and what is the date and time today?
It is April 23rd-ish, 2022.
Perfect. So do you know why you're here and why you're being evaluated?
Yeah, no, nothing specific. I just came in to get checked out.
Okay, great, perfect. So based on his answers, I would say that he is alert and oriented and awake. So he's awake, alert, and oriented times 4. And now, after I've completed the general survey, I am going to go on to his skin. I'm going to inspect and palpate. And basically, I'm just going to visually inspect with my eyes. I'm going to look at the color condition, and I'm going to look for any lesions. So I do notice that his skin is uniform. The skin color is uniform. And I'm going to have you just remove your shirt. Skin color is uniform, consistent with genetics. There's no obvious deformity. Skin integrity is intact. There's no lesions. And when I say lesions, I don't see any primary lesions, which would include nodules or vesicles, or secondary lesions that would include like ulcers or any macerations, and then any vascular lesions, which would be hemangiomas or granulomas. So skin looks good. As far as temperature, it is, of the normal variation there. It's warm. It's not diaphoretic. And I'm going to test on this side too. Perfect. And then I'm just visually looking, everything anatomically, it looks very equal and symmetric. And I'm also gonna check for, you know, I know we talked about the skin hydration, but I'm gonna check for, you know, turgor, and this can be done, you know, up here, you just pinch, or you can do it by the arm. And I'm just gonna pinch and make sure that his skin goes back and there's no obvious appearance of any tinting, which indicates to me that the patient is well hydrated. And then secondly, I would want to check with the skin is any swelling. And how I would do so is I would squeeze the patient's ankles and I would release. And I basically just want to see that the skin goes back to its shape and there's no pitting edema. So I would say the patient has no pitting edema. And then as far, I'm so sorry. And then as far as the turgor, temp, and that would conclude the skin exam. I would then go on to nails, hair, and then the head. So as far as the nails, I'm gonna look at his nails, and I notice that they are of normal coloration. They're pink, the nail beds are pink. They're consistent with genetics, and they're well groomed, they're clean. They've got a concave shape to them, and they've got a concave shape, and the angle is no more than 160 degrees. I don't see any lesions or any deformities. There's no clubbing. There's no striations or grooves in the nail beds. Everything looks good there. I'm gonna check his toes too, and everything looks great. And so what I'm gonna do too is I'm gonna check capillary refill time, and I'm just gonna squeeze his nail bed. I'm gonna get that white blanching effect on it, and then I should see a rapid return of blood, and that's what we call the capillary refill time, and that is less than 2 seconds, so that is good. Are you doing okay, sir?
Great.
Okay, so I'm gonna continue on, and I'm basically now done with the nails. I'm gonna go on to the head, and just from general appearance, I would say that it is normal cephalic and atraumatic. I'm gonna inspect your scalp, and I'm gonna say it's free of lesions. There's no dandruff. It's well groomed. It's well kept. You're clean. It's got normal hair distribution. I would say the same of the eyebrows. They are also symmetrically placed. Eyelids are free of any nodules. I don't see any discharge or any tearing coming from the lacrimal glands. Eyes, conjunctiva are non-injected, sclera are white, pupils are black and equal bilaterally. And then I am gonna actually do some vision testing on you. Do you mind?
Oh.
Okay, let me get my huge gloves on. Okay. All right. Okay, this is my tongue depressor, and I'm just going to use that to inspect your oral mucosa, and then this is my pen light.
Mom,
All right.
okay,
I'll take the baby. Okay. All right, so basically, no. All right, and I know it said that his eyes are, the irises are the irises are brown, they're round, the pupils are black, they're equal bilaterally. I am gonna do some pupillary reaction testing on you. First thing I'm gonna do is I want you to watch the tip of this and just follow it. And I'm not gonna go too fast, follow it slowly. Okay, and then I'm gonna come close to you and just keep following it. Very good. And then now I don't want you to follow it. I want you to look straight back to the wall there. This is my pen light, and I'm just gonna shine it. Don't look at me or anything. Don't look directly at the light either, okay?
Mom.
Yeah.
Mom.
Okay, lay down.
Daddy's right here.
Okay. All right, I'm just gonna...
Mom,
Mhm.
you saw your volume now.
Yeah, I will. I'm sorry. All right, so I'm just gonna shine the light. I'm gonna follow it through. All right. So I noticed a direct reaction on the left eye where it constricts, and then I see actually a consensual reaction happening on the right when I'm doing that. When I did the convergence and the constriction test, I do notice that an accommodation was equal bilaterally. So I would then state that pupils are equal, round, and reactive to light and accommodation. All right, so now I'm just going to use my tongue depressor. We're going to go on to everything. Oh, I do need my light too. So I'm going to go on to your ears, and I'm going to just visually inspect the external part of it. And I notice they're free of lesions. I don't notice any like growth surrounds. I am going to pull back on your pinna here. I'm going to go back and up, and I'm going to look inside. There we go. I'm going to shine a light. Sorry. And okay, I see that the inner ear canals are patent. They're free of cerumen. There's no erythema, no drainage, no blood. So you're looking pretty good. That's good too. Okay, perfect. All right. And then as far as your, oh gosh, we did your eyes, your ears. And another thing I want to say is that everything is aligned normally and symmetrically. One's not more raised than the other, so that's great. And you weren't having any pain when it was examined, right? Okay, great. Internally, everything looked good. I just want to check the hearing. I'm going to have you shut your eyes.
Okay.
And I'm going to snap on one side, and I just want you to tell me if it's left or right.
Okay.
Okay.
Left. Right. 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 Left.
Okay, so hearing is intact bilaterally, very good. And then I just have a couple of questions. Do you wear any like assistive aids for your like hearing aids?
Not yet.
Okay, and then do you have any like occupational or any hobbies that you would be exposed to really loud noises in your environment?
Only concerts when I was younger, but nothing.
Nothing recently. Okay.
No.
And then do you put anything in your ears like to clean them, like say a Q-tip or anything like that?
I really don't.
Okay, no, that's
Just
good.
kind of wait for the annual.
Physical, yeah, exactly. Okay, well, perfect. Thank you so much. Now we're done with that. The last thing I'm going to do is I'm going to visually inspect your nose.
Okay.
I notice there's no deviation. It is midline to your face. I see that the nares are patent. There's no discharge. And then, so that looks all good. I don't see any lesions. And they are normal size, symmetry. And let's see here. There's no pain upon palpation. Okay. All right. And I'm just going to palpate. No tenderness over the sinuses.
Oh, good.
Okay, perfect. Last thing I'm going to do, I got to get my my tongue depressor.
Okay.
I'm going to shine my light. I'm going to visually inspect the inside of it. Okay. And I noticed that his soft palate is normal, free of any nodules or lesions.
Sorry.
His
My throat cramped.
His
I
uvula.
apologize.
It's okay, no worries. His uvula is midline. Tongue is centrally positioned, and it is pink, moist. It's slightly textured, rough, and then I'm going to pull down your lip. Don't laugh though, because I needed to.
Oh, okay.
What is that sound?
I think there's a dog. Is this a veterinary?
I don't know. It might be. Okay, I'm gonna pull down your lip. But you can't smile because it makes it hard.
Let me gather myself.
Okay.
Nurse. Nope, there you go.
Oh. All right. So anyway, I am just looking at his buccal mucosa. Mucous membranes are moist. Dentition looks in good repair. They're white. It looks like all of them are intact. All of them are intact. But it looks like they're free from decay. I'm gonna have you open one more time. Great. Oh, posterior pharynx is good. There's no cobblestoning or erythema. Everything looks great.
Great.
Okay. I'm gonna take a quick sip here.
Yeah.
You doing okay?
I'm doing great.
Is that Murphy? Amazing. Okay. Let's move on. Anyway, but your gums and everything look intact too, and they're
Thank you.
moist. And I'm gonna have you do one thing for me. As far as your mouth, can you whistle? Okay. So I do notice that your lips do purse and are equal bilaterally. Your lips are intact. They're pink. There's a very nice vermilion border to it. And
Would you mind, ma'am, closing the door?
yeah, I'll close the door.
They should have never done a doctor /
I know. I can't believe there's a veterinarian place right around.
The doctor does both. It's
Yes,
crazy.
exactly. So now I'm going to go on to the neck. I'm visually inspecting it. I don't notice any, it's equal on these sides. There's not any bulges or masses. I don't notice any goiters. I don't feel any goiters. Trachea is midline, normal position. It's smooth. I don't feel any lymphadenopathy. Sorry. And I'm going to have you do head to chest, or back to chest. Okay, and then side to side. Great. And it looks like normal alignment. Position is normal. It's symmetric. I don't see any accessory muscle use or nasal flaring or any jugular venous distension in his neck area. Like I said, trachea is midline is smooth. There's no evidence of any nodules. And then now I'm going to go on to the upper extremities, and I'm just going to inspect them. I'm going to check out the wrists, the elbow, the fingers, and I'm going to have you flex your wrist. Okay, there you go. And then I'm going to have you rotate your wrist. Okay, then I'm going to have you flex and extend your fingers. Okay, perfect. I don't feel any crepitus, so his joints feel like that they have full range of motion. There's no pain upon doing these testings. Okay. And then I'm gonna test your muscle strength. I'm gonna have you squeeze my fingertips.
Okay.
Yep, bilaterally. Okay. So muscle strength is equal and full bilaterally. The skin looks intact. The temperature feels good. It's nice, warm. It's not overly sweaty or diaphoretic. And so the joints are good. The muscle strength is good. Inspection, okay. And then now I'm gonna do the right radial pulse. And so I'm gonna go right on this side.
Sure.
And I'm just gonna go right in this groove here.
Okay.
Sorry.
That's okay.
There we go. And I'm gonna listen to it for 30 seconds. I'm not really going to listen to it for 30 seconds though, because that would cut into my time. So what I would notate is that his radial pulse is regular rate and rhythm. It was, just very normal variation, or normal, no extra beats, no variations. So now as far as and I would also say that the amplitude of it is 2+ and normal. It wasn't bounding or weak or diminished. Now I'm going to basically do the same on the lower extremities.
Okay.
I'm going to look and inspect. I'm going to palpate colors uniform and consistent with genetics. I don't feel any nodules. I don't visualize any incisions or any wounds, anything like that, any lesions. I'm going to inspect the toes. Toenails look good. I am going to do the cap refill. Cap refill is brisk and returns within less than 2 seconds. I'm going to feel the temperature, and it is very normal. And then I am going to check the dorsalis pedis pulse, which is going to be on the dorsal aspect of the foot. I'm going to feel for it. I would normally listen for it. I'm not going to listen to it for the full. I'm going to hold your foot up just like that. Perfect. Okay. And I would say that's 2 plus regular rate and rhythm, 2 plus an equal full bilaterally. And then as far as, I'm gonna have you flex and extend your knee, okay? And I'm gonna have you rotate your ankles and flex and extend it. Okay. Any locking of the joints or any, feeling any grinding? Okay.
No, feels good.
Okay, great. No pain elicited?
No.
Okay. So I would say that the joints are equal bilaterally, full range of motion. I'm gonna have you take your feet on my hands and push down. Or it'd be easier if I go like that. I want you to push against my hand.
You got it.
Okay. And then I want you to pull back. Very good. One more time on this one. Okay, pull. And then push against me. Okay, so strength is equal bilaterally and intact. Very good. All right. So now we're just we have just a couple more. You're being so great with me. I appreciate it.
Sure.
I'm just gonna do the lungs, the heart, and the stomach, and then we'll be done. So as far as the lungs, I'm gonna inspect anteriorly, posteriorly. I'm gonna look at the AP transverse ratio. It is 2 to 1 in normal, no barrel chest. I don't notice any accessory use any use of the accessory muscles, no respiratory distress. Breathing is very equal, unlabored. He's got normal skin, it's intact, color is good, temperature is good. I'm gonna start by listening. And basically what I'm gonna do is I'm gonna start at the apices of lungs. I'm gonna go side to side and work my way down. I'm gonna have you breathe just a normal breath, slowly. Breathe in through your nose and then out through your mouth, okay? And I'm gonna go above the clavicle. I'm gonna listen right here. Hang on 1 second, I just gotta get my placement.
My bad, I jumped again.
Okay, down to the second intercostal space. Second on the other side. Very good. And then I'm gonna do your lateral, and this is your left. You only have 2 sites here because your left lung only has 2 lobes. If I was doing it on your right, I would check for 3 different sites because your right lung has an upper, a lower, and a middle lobe.
Okay.
So I'm just gonna do the upper and lower. And then I'm going to do your back, but I'm going to have you turn around. Very good. And again, I'm visually inspecting the posterior back. Shoulders are of equal height. Everything's very normally aligned and positioned. I'm going to start again. This is going to be the scapula above. I'm going to go in the midline of the scapula above. Deep breaths this time.
Okay.
Mm-hmm. And I'm sorry, I gotta make sure where your scapula is because I don't want to go over your scapula. I'm gonna kind of follow the outline of it because then I won't be able to hear it as well.
Okay. Ready?
Yep. Very good. Very good. so we are done with that portion. Okay, so I just wanted to kind of talk about my findings right now. When I was assessing the sounds up here, which are your tracheal sounds, and then when I get down to the mid-chest, these are going to be your bronchial vesicular sounds, and then everything that's in the periphery or your lower lung bases, those are going to be your vesicular breath sounds, and that's going to include the back, the lower lateral lung bases.
Okay.
I didn't hear any adventitious sounds like any crackles, wheezes, any rhonchi, so everything was very clear and equal bilaterally.
Okay.
You're amazing. All right, so now I'm going to go on to the heart. I'm going to listen to your carotid pulse as well as the 5 different locations where I can hear different sounds. And I'm also going to assess your PMI at the apical, which is your apical pulse. And the reason why it's called your PMI is that's the point of maximal impulse.
Sure.
And that is where you can hear it the best. It's like the strongest pulse point.
Okay.
So, and you don't have to, it's not like the lung exam, you don't have to breathe. I don't need to, I'm going to be listening more for the heart sound, okay? And the first one is going to be a right second intercostal. So second intercostal space, sternal border. Okay. Then I'm going to go over to the left second intercostal, second sternal, or left second intercostal space, sternal border, left sternal border. Okay, third. Okay, fourth. Okay, fifth, and this is where the PMI is. Okay, normally I would listen to this for a full 60 seconds, but I'm not going to for the purposes of this exam. And I should say that S1 is heard loudest at the apices, at the apex of the heart, not apices, the heart is only one. So, and then S2 is heard loudest at the base. And then Erb's point is where you hear S1, S2 sounds. And then, like I said, at the fifth intercostal space is mid-clavicular line is where you're going to hear the pulse of maximal impulse, which is going to be your apical. So we have concluded the heart. Now, the last thing we are going to do is your GI. And I'm going to basically inspect, looking at the color, the symmetry, the contour. I'm also going to notice the pulsation of your abdominal aorta, I should say. And then I'm going to auscultate the vowel sounds, and then palpate very lightly. I'm just going to make sure that there's no masses, that you're not having any pain or tenderness, okay?
Sure.
So I'm going to have you sit right here,
Okay.
or lay down right here, sir.
I'll just lay on my back.
Yeah, just lay on your back. Oh, I'm sorry.
Oh, this way?
Yeah, lengthwise. No, with your head this way.
Okay.
Yep, sorry.
Trying to get out of the way. So what you in here?
All right. So basically, I'm gonna start with the visual inspection, and I really don't see anything. I don't see any obvious deformities. I don't see any obvious deformities. I don't see any masses or any bruises, any ecchymosis. So I'm just kind of feeling around, palpating. I don't feel any firm masses. Muscle tone, it seems firm. Contour is flat. Normal hair distribution and skin color is uniform. I don't see any like jaundice or any cyanosis, pallor, erythema. I am going to start for the mouth sounds, And I'm going to start in the right lower quadrant. If I can hear them there, then I know that they're going to be in all vowel sound, or in all quadrants.
Yep.
So right lower quadrant. If they're absent, that's not good. Could be a sign of an obstruction or an ileus. Okay, very good. So that's what we would call normal active vowel sounds. I just heard some gurgling and some little popping. That's completely normal. All right, perfect.
Pretty cool.
All right, and then I also noticed that there was no masses. The last thing I'm gonna do is I'm gonna kind of lightly palpate. You're not feeling any pain when I do this?
No.
Okay. Okay. There's no rigidity. There's no guarding or rebound tenderness. So, all right. So that concludes our exam.
All right.
Before you get up, though, I'm just gonna make sure that the bed is in the lowest position, and then I'm gonna lock the bed in place, and then the call light. Here, let me put the call light on you. If you need to call for anybody, make sure you push that light.
Okay.
And then, is there anything else that you need today before the doctor comes in and kind of does a more thorough exam?
No, I think that was thorough and quite wonderful.
Thank you. I'm just gonna wash my hands here, or I'm gonna take my gloves off. I'm just gonna wash my hands before I leave. All right. Okay. Well, thank you so much for your time, and it was a
Thank you,
pleasure
nurse.
being your nurse.
Yep.
All right. Take
See ya.
care.